Health workers should always be vigilant for the possibility of gender-based violence in all patients. We have learned about identification of gender-based violence survivors and process of history taking applying the guiding principles. By the end of the session, we should be able to perform detailed physical examination of the survivors according to the clinical protocol. Now, we are going to focus on examination of gender-based violence survivors. Please keep in mind, while examining survivors, confidentiality with informed consent is a must in every step. We should welcome the survivor and the attendee warm-heartedly.
Namaskar, my name is Sarala. I am the health worker here. Shall we go to the examination room? So are you comfortable with your attendee staying outside?
We should make them comfortable so that the survivor feels comfortable and opens up.
Please make yourself comfortable.
We should make the survivor change her clothes over a clean white bed sheet or white chart paper and wear the gown so that no evidence is lost.
Now I am going to start the examination. Is it okay?
Stepwise physical examination needs to be done. We should first note the survivor's general appearance and demeanor. Observe mental status as per Annex 7 and document it accordingly. Take the vital signs, that is, height, weight, pulse, blood pressure, respiration, and temperature. Start with the survivor's hands. This will reassure the survivor. Inspect both sides of both hands for injuries.
Can you extend your hands?
Observe the back of the hands for scratch marks, broken nails, and scrapings on the nail. Collect the scrapings from fingernails using toothpick on a white piece of paper. Fold it and document it. Wrists for signs of ligature marks. We should inspect the forearms for defense injuries. These are injuries that occur when the subject raises a limb to ward off force to vulnerable areas of the body. Defensive injuries include bruising, abrasions, lacerations, or incised wounds. Any intravenous puncture sites should be noted. We should carefully observe for the signs of bruises on the inner surfaces of the upper arms and the armpit or axilla. Survivors who have been restrained by hands often display fingertip bruising on the upper arms. Let's repeat what we have learned so far. A systematic, top-to-toe physical examination of the survivor should be conducted in this stepwise manner. Vitals should be taken. Start with hands. Nails should be checked. Fingernails scraping should be collected if needed. Wrists should be checked. Forearms should be checked. Upper arms and armpits should be checked. Remember, confidentiality and survivor's consent is must. Documentation should be done as per Annex 3. Now we should move ahead and inspect the eyes, nose, mouth, ears, and neck. Remember to collect a swab and document properly whenever needed.
Now I am going to look at your face. May I?
Look for black eye, bruises, and swelling around the eyes. Look in the nose for signs of bleeding. The mouth should be inspected carefully.
Will you please open your mouth?
We should check for bruising, abrasions, and lacerations of buccal mucosa. Petechiae on the hard or soft palate may indicate penetration. Check for torn frenulum and broken teeth. Collect an oral swab if indicated. Inspect the area behind the ears for evidence of shadow bruising. Shadow bruising develops when the ear has been struck onto the scalp. Gentle palpation of the scalp may reveal tenderness and swelling, suggestive of hematomas. Hair loss due to hair pulling during the assault may cause large amounts of loose hair to be collected in the gloved hands of the examiner. The neck area is of great forensic interest. Bruising on the neck can indicate a life-threatening assault. Imprint bruising may be seen from necklaces and other items of jewelry on the neck. Suction-type bruising from bites should be noted and swabbed for saliva before being touched. Remember, the face area is of great importance as the bruises heals rather slowly and is easily visible. Also, don't forget to collect the swabs for evidence and document the process properly. Now we should move ahead and inspect the upper body.
Now, I am going to examine your back part, okay?
Start with the back. Only expose the area that is being examined. The shoulder should be separately viewed. The back takes impact when struck on hard surface or ground, so bruising and more obvious bruising may be seen in a variety of places on the back. The breasts and trunk should be examined with dignity and privacy. Breasts are frequently a target of assault and are often bitten and so may reveal evidence of suction bruises or blunt trauma. Exercise 1. Identify the pictures. The survivor can then be reclined for an abdominal examination. Inspect abdomen area for bruising, abrasions, lacerations. Abdominal palpation should be performed to exclude any internal trauma which can present with tenderness or to detect pregnancy. The upper body inspection is crucial as it can reveal not only the external but internal injuries as well. With the survivor in a reclined position, the legs can be examined in turn. Start with the front of the legs. Inner thighs are often the target of fingertip bruising or blunt trauma. The pattern of bruising on the inner thighs is often symmetrical. We should check for the abrasions on the knees. We should check for the evidence of abrasions or lacerations on the feet. It is important to inspect the ankles very closely for signs of restraint with ligatures. The soles of the feet should also be examined. It is advisable, if possible, to ask the patient to stand for the inspection of the back of the legs. An inspection of the buttocks is also best achieved with the patient standing. Alternatively, the patient may be examined in a supine position and then rolled slightly to inspect each buttock. Biological evidence should be collected with moistened swabs or tweezers. As a general rule, the presence of any tattoos should be documented in the examination record, together with a brief description of their size and shape, as these may become a means of assessing the accuracy of the observations of the examining practitioner in court. Similarly, obvious physical deformities should be noted. A standard positioning and technique must always be used in external and internal examination of genitalia. The technique used must not cause undue pain, physical and mental discomfort to the survivor, and the health worker must always select examinee-friendly technique. Position and technique employed must be recorded.
Now, I am going to examine your private parts. Please be comfortable. Is it okay if I start now?
With the survivor still in a supine position, take necessary genital samples prior to examination of each component of genital examination. Note the presence of bleeding, perineal tears, discharge, presence of foreign materials. Note and draw the type of hymen. In case of any doubt, refer to higher center. Points to remember. Healing in hymenal trauma is rapid. The hymen when stretched may recover, even in cases of penetration, and there may be normal findings. Size of the hymenal opening depends on age, stage of pubertal development, position of patient, degree of labial traction, relaxation of child, and obesity. The usual shape of the hymen is annular or crescentic. Healing may lead to contracture. Healing may take place if the child is protected from further abuse. Attenuated hymen due to chronic abuse does not recover. A normal hymeneal orifice does not exclude chronic sexual abuse. On the other hand, a minor abnormality does not prove chronic sexual abuse. The hymenal opening is usually symmetrical in mid-childhood. The following should be considered as possible signs of previous trauma. Marked asymmetry, for example, a small notch at 11 o'clock and a marked notch at 1 o'clock, sharp angles and square angles. Exercise 2. Identify the pictures.
Now we proceed for vaginal examination and collection of swabs. I have collected all the samples needed. Findings have been documented and they will be used as evidence when required. Is it okay with you?
We have now learned about detailed physical examination for identifying injuries related to gender-based violence. This is to be followed by treatment, counseling, and appropriate referrals. Remember the following key points. We should make sure about maintaining confidentiality and privacy in each step. Informed consent must be taken for the examination. The examination should be done in a stepwise manner so as not to miss any evidence. All the findings of the examination must be documented in appropriate forms for evidence. Now we will proceed with detailed vaginal examination